Gateway to Wellness. In this week's Apple of Days segment, we're actually doing live with all the kind of craziness that's been happening out there. We wanted to come to you and start to give you a little more information about kind of things you can do, kind of to understand a little more what's happening, but also things you can do to stay healthy and make it so you can enjoy this time actually. And so first off, we kind of wanted to talk a little bit about kind of what this COVID-19 coronavirus is, kind of some of the symptoms, kind of different age groups is that maybe do need to take a little more notice here, but also different things your family can do, different things we're doing here, and then different things we're doing for the community where everybody can help out here. And so first off with COVID-19, coronavirus, really the family for coronavirus has been around for quite a while. This strain is new, but it's in the same family as SARS, different things like that. And so it is actually something that's been known out there, but it's just this new strain that's been going through that's a very contagious strain at this point. That's why kind of all the hoopla about there, just because how contagious it is in there. With some of the symptoms, we've been asked about that on our Facebook page about what the symptoms are. And some of the things you kind of know, but fever, cough, and shortness of breath are some of the main things. There is a sore throat, different things, especially with the upper respiratory tract, that are associated with it. And so we want to make sure those are the things you want to watch for when that's coming on. And if you do feel any of these things, then they do have testing and different things that you can do now to find out, but find out for yourself because it is so contagious out there. But some of the groups that need to kind of pay extra careful attention to this are kind of our more wise patients. So we have our wise people in the community, especially those over 80, because those are the ones that's actually kind of being more kind of aggressive. With those actually that have done, as they've done the statistics, it's right around 15%, 14.8 actually, that actually get the COVID-19 that actually end up dying from that. But once we start to go down from there in the 70s, it's down to 8%. Once we get down past that, it drops off really quickly to where it can become very aggressive for people that are immune compromised or have different lung problems, different things like that. But the biggest groups that need to make sure to kind of keep their eye out if you're in one of these groups, to kind of stay in a little bit more and kind of stay away from other people that might have it, is that group of kind of 80-year-old plus as our big ones. That next thing we want to do kind of as we're going through this too is if anybody has any questions, make sure to ask in here and we will make sure to answer those as we go along. But to protect your family, we've all heard about doing the hand washing for 20 seconds. It's kind of funny that it took us something like this to make it so hand washing was cool again, but making it so we can keep those things, that this virus actually is one that can be eliminated through hand washing or through rubbing alcohol, different things, to where as long as we wipe down stuff, different things, we can take a lot of precautions on making so it doesn't pass around. Also nutrition-wise, there's a lot of things you can do to kind of help your body to be the strongest, to help prevent you from really having a big of a chance of that virus entering. Because whenever we look at any type of sickness, the weaker your system is, the more susceptible you are. I always put it's kind of the one that's most adaptable wins. The more our body can be adaptable to the stressors coming at it, whether it's just regular stress or whether it's some other virus or anything coming at it, the better it's going to do. And so if we think through that, kind of different things we can make our body more adaptable, we can know a lot of the things we can do to stay healthy. Some of the ones specifically with this, kind of anytime we deal with a virus, especially as wintertime viruses, or actually the SARS even, is actually, or coronavirus, I mean, vitamin C and vitamin D3. And those are a couple big ones as we're going through the wintertime, but those are two things we can do to kind of help to push that immune system up, to help out. Vitamin D3 is one of the big ones they've found out over the last few years. Basically, that's our sunshine vitamin. During this time of year, we don't create as much because it's made through sunlight on the skin. And so we need to supplement that during this time of the year to help to keep that part of our immune system up. So make sure that you're doing that. Make sure you're taking it. Actually, it's quite a bit, especially when something like this is going around. What the studies actually tell us is right around 10,000 IU. And so make sure to get that. If we're not, especially if we're not getting outside, we have a little more cloud cover and everything right now, so you aren't going to make it anyways. So that's one of the smart things to supplement. You can also, there's other things such as, there's one we use here in our office from doTERRA. Actually, it's actually one of their different oils, different things that kind of can help out there. Elderberry is another one. Also, like I said, get outside, take your kids outside as much as possible. We talked about social distancing, but you can still get out in your backyard, get into the fresh air to help that immune system stay up. Also, stay calm. That's one of the biggest things I'm seeing out there, is so many people are getting anxious and scared about what's going on. That's one of the worst things we can do, because whenever we think about that, whenever we start to have more stress, we actually create more cortisol in our body, which actually drives down the immune system. So we want to make sure that we are staying more calm throughout this. We talk a lot about in here about breathing, about posture, all these things about getting our body out of that overdrive response. And so we want to make sure to do those things that we can to kind of help to bring down that stress response and get out of that fight or flight response, because then our body can't fight off as well. We create that environment where our body's more susceptible to these things. But staying calm is a huge thing. Also, one thing just helps out with that stress is to come in and get adjusted. We are still here. We're going to continue to be open as long as they'll let us. And so, but as we get adjusted, it actually helps that through helping the neurology, it helps the immune system to stay where we want it to be, to where our body's more adaptable to the things coming at us. But with that, some of the things that we're doing actually around here, so you feel safe about coming in, would be some of the things we're doing actually is we're making sure to use the Lysol wipes, all those things. We're actually wiping down actually about every patient, after every patient, to start clean our tables and everything here. We're also having our staff wipe down quite a bit throughout the whole office to keep everything clean and keep everything going the way we want to. Also at our office, if you want to have that extra space to where you don't want to be around two people right now, make sure to text us when you get to the parking lot, and we'll text you back once we see that you actually can come right in onto the table to get adjusted and be gone before you're around anybody. Also, this is one time I usually tell people when they're sick to get in here to get adjusted so they can help to bring up the immune system again to help them out. But for just right now, kind of especially with this, how contagious it is, we want to make sure to protect our practice members. So make sure if you are showing any symptoms, stay home at this moment, just give us a text, everything like that. If we need to help you out, we can do that after hours, different things there. But we want to make sure to keep our environment here safe for all of our other patients there. A couple of questions we had come in. Sharon, thank you for being on here, right here. We're going to keep on bringing these suggestions out there. Joyce, vitamin C should be taken 2 hours. There are a lot of different things on vitamins. We have to kind of look at different ones that are processed better when we have fat in the body, different things to help more absorption rates right there. And that is true on making sure to have food in your stomach with vitamin C to kind of help it to absorb right there on that. But also a few things we want to do here at our community, because one of the things we know, there's a mentor of mine, if some of you might have heard of him, Prince EA, he's a great guy, puts out a lot of content out there to where he talks about whenever he is looking for something to put out, he's always looking at how can I make people happy? How can I bring a smile to your face? Which that actually is one of the big things right now. On the better we can keep our environment, better we can keep our mood, all these different things, the better, healthier you're going to be throughout this. And so we're trying to do things through and here to help out our community, because there's a lot of people that not only are suffering from this, but also because of lost work, all these things, they're suffering other ways too. So as we're in here, we're actually going to be over the next while actually accepting donations for the food bank to bring over to the Hill Country Ministries at the end of the month to start to support them so they can help out those that are a little bit less fortunate, those who need. Also, as you're going through this, if you need help, one of the strongest things you can do is to ask. We always think that the weak person's the one who asks, but actually one of the strongest things you can do is to ask for that help, no matter what way it needs to be. And we can help to direct you to people, whether it's with the stress, whether it's with food, all these things. We hear of all the people going to the grocery stores, the lines, everything like that, and everything that goes into that. Some of the things with that, remember some of the symptoms on this kind of hit, kind of a one thing that we've seen quite a bit. One of the symptoms with this minor symptom is kind of diarrhea, but it's a very minor thing, so you do not need to be hitting the stores to grab your huge things of toilet paper. You just have the same amount that you usually have, and you're going to be fine there. So don't worry about that with all that being gone, because that's not really one of the major things that goes in with this one. But also throughout this time, we're going to start to bring a lot of content out to you guys. We want to stay even more in communication with you, because the more we can have this community for us, the healthier we can help each other be, especially as more people are staying home, different things, gyms are closed, all these other things that help us to stay healthy. And so we're going to start to bring you more and more stuff, more and more content throughout these next couple weeks. From home exercise to little meals, simple meals, different things you can do to kind of stay healthy there. Also, we will make sure to tell you on any closures that are happening here or with any of our other businesses that we know. Also, just kind of to get back onto the businesses, if anybody else has a business that would like to take part in collecting food for the Hill Country Ministries, tell us so we can kind of coordinate with them to be able to help everybody out here. But we will make sure to tell you if we are going to be closed. We're basically going to stay open until the health department tells us we have to close. And so we'll be watching our board's website and everything like that and waiting for any word from them. But as for right now, we are here, and we're here to help out through every way we can. Once again, this is Dr. John, and going to wait to see if anybody else has any questions here. If not, I am going to be done with our segment for today. But once again, we'll be starting to push stuff out probably every day or two, just to help to stay in communication, help you to have the things which you need to stay healthy and to continue to be well, really, right there, to stay out of all the fear and everything that's going into this. Once again, it's Dr. John at Gateway to Wellness Chiropractic, and have a great day.